Hello everyone, I am Dr. Poonam Negi. I am an intensivist at VHS. So today we are going to talk about the physiology of nutrition. This was a demand class, so you actually wanted to know how a nutrition impacts on a critically ill patient. Why is it so important that we all nowadays stress so much on nutrition, and how is it going to alter our outcome and as such in a critically ill patient? So earlier were the days where patients were not fed, whether it was a pre-op patient or a post-op patient or a very critically sick patient, wherein there was no stress or importance given on the nutrition. There was an increase in the morbidity as well as a poorer outcome when there was no nutritional stress given. Then there were a lot of studies done. There was an ERAS protocol which happened. There were a lot of guidelines which were formed. Why? Because it was clearly shown that in a critically ill patient, adequate nutrition as per his resting energy equivalence, as per his respiratory quotient and as per his metabolic demands not only impacts the mortality but also it increases the his outcome from the patient. If the nutrition as such is not adequate, if there is a poor nutrition in the critically ill patients, the mortality is directly influenced because of the poor nutrition. It increases its hospital length of stay. It increases the infection chances. It increases the rate of mechanical ventilation days, the inotropic requirements and everything. So there were statistically significant differences which were shown and proven of the impact of nutrition on a critically ill patient. So before we know why do we need to give nutrition to a critically ill patient, let us see the forms of energy we take. So we require energy not just for our physical activity but also to meet our resting energy equivalence. That is, the resting energy equivalence is the amount of energy which an individual consumes in 24 hours to meet his basal metabolic needs, to meet his thermogenesis, or for his respiration, the energy required for respiration, the energy required to maintain cardiac output, the energy required to maintain the digestive system and the basic enzymatic activity which occur at the biochemical level. So this form of energy to us in nature is being provided in the form of carbohydrates, in the form of proteins and in the form of fats. And as we all know that whenever we take these form of energy like carbohydrates, proteins and fats, this gives us certain kilocalories of energy. So a 1 gram of carbohydrate, so if you have an intake of 1 gram of carbohydrate or 1 gram of protein, it gives you around 4 kilocalories of energy. Whereas if you have a 1 gram of fat, it gives you around 9 kilocalories of energy. So this is the burning of these substrates like carbohydrates, proteins and fats which contribute to our energy. And this energy which we need to fill our basal metabolic needs or your resting energy equivalence, this is a very important concept, REE, that is your resting energy equivalence. So this resting energy equivalence was calculated by a very famous equation called as Mifflin-Sengeur's equation, which calculates this resting metabolic rate in men and women. You need not remember this but have a basic concept that the amount of energy or the amount of food we take is the total energy which we need. Out of that total energy, we require the energy to meet our resting energy expenditure or our resting metabolic rate, and then we utilize it for activity related energy expenditure. So what is activity related energy expenditure? You will be knowing it is all the physical activity we do, we talk, we speak and the other things. But our resting energy equivalence or the resting metabolic rate is the energy which we require for our diet-induced thermogenesis, for our basal metabolic rate, for our temperature regulation, for respiration, for maintaining of cardiac output. So why this REE becomes important is this is the minimum amount of energy which you are supposed to supply to a critically ill patient. Because if you derive or deprive the critically ill patient with this energy of his REE, he will, that is the energy required for his basal metabolic rate, for his cardiac output, then definitely it is going to impact your mortality. So always keep in mind Why we talk about energy is because we have to give him his REE substrate at least, so that regular physiological function in his body is maintained.